So, yeah, we were on scene the other day. So, guys jumping in and out of traffic. Trying to jump on cars. Police show up to ask him why he's got blood on his hands. He decides to get all punchy with the police.
Okay, that normally goes well.
Yeah, gets tased twice.
Yeah.
Once in the front, once in the back.
Oh, damn.
Back barbs are still in. I couldn't get them out. But I'm looking around and seeing as we pull up, because we get on the way to the call, we get the information. No, adult male jumping in and out of traffic, and they kind of give a description of it. I'm like, oh, okay. So we get to the area, and there are 9 cop cars on scene. And I think to myself, I didn't get the whole story.
Yeah. There's a piece missing.
So I hop out when the officer's like, we're recording.
Mm-hmm.
I'm like, okay, hey, thank you for telling me that. And not only are there 9 police officers on scene, there's 2 sergeants, a captain, and somebody with a radio and a business suit. Who might be the chief. Or very close to the chief.
Okay.
Okay,
the
so
story has my attention.
Play this one straight.
Yeah.
Hey, speaking of straight, welcome to Medical Stuff. My name is Mark Frankham, and that is Chris Finkston over there. How are you doing tonight, man?
I'm doing good. How are you?
I'm doing okay. Tonight's topic is going to be about transgender. Transgenderism?
I don't know.
I mean, I know it's an adjective.
Yeah. Well, it's certainly been a topic that I think has been on the tip of everybody's tongue lately.
Right. So, again, like the term transgender is not a noun. A person is not transgender. They're a transgendered male or transgendered female. It's a descriptor. That's one of the first things we're going to go with. So, being transgender, what does it mean?
Well, transgender, from my understanding of it, is when someone is, let's say, born biologically male.
Right.
However, as they go through life, they start to discover through various interactions and experiences that they more closely identify as a female. And this can cause, I believe it's something called, what is it?
Gender dysmorphia.
Yes, gender dysmorphia.
But before you even get to
dysphoria.
that.
Gender dysphoria.
Dysphoria, sorry, yes. So before even that, definition of being transgender is denoting or relating to a person whose sense of personal identity and gender does not correspond with their birth sex. It's also not the same as being gay and lesbian.
And that's a lot of confusion nowadays, is people confuse sexual orientation with gender identity.
Right.
And that's not the same thing.
No.
Sexual orientation is who are you attracted to as a mate.
Right.
Gender identity is what do you identify as.
What do you identify as? Because, we may touch on this a little bit later. I think the biggest problem with people understanding anything about this subject or even homosexuality or bisexuality, being transgender is, so Chris, you're a geeky white guy.
Yeah.
Do you identify as gay or straight?
Straight.
Straight. Well, I'm sure your wife is very,
Yep.
very happy with that. Yeah, a little moment there. So, but being straight to you just feels natural.
Yeah.
That's just, you see women, you think, hey,
yeah,
they're attractive.
The problem, Mark, is that they're also attracted to me. It's kind of hard not to.
Look, you found one.
I found a good one,
You
though.
found a really good one. Don't get me wrong. We have talked many times about how you married out of your league.
Yeah, no, and that's cool.
So, but the thing is that I think with a lot of problems with people who identify as heterosexual is that it feels so natural to be attracted to a person of the opposite sex that they can't comprehend it feeling natural to be attracted to a person of the same sex.
Right.
And so, or, as the topic for today being transgendered males and females, they don't understand the fact that it just does not feel right to be the sex that you were assigned at birth.
Yeah. And I feel like I lucked out. Because I was born male, I identify as male, it's never been a problem. But it is one of the things that, as I go through life, and I meet people, and I discover people, and there's 2 people actually that are on my mind that are going through this transition right now. Mm-hmm. The time period living as someone that you don't identify as can be harrowing.
Well, I mean, and like I said, we'll get into a lot of this stuff a little more in depth later, but there's a difference between empathy and sympathy.
Yeah.
I can empathize because I can imagine what it would be like, but I can't sympathize with them, not because I don't care, but because I'm not living it.
Right.
And so to not like your body to the point that you want to change it physically. And when I say, change it physically, look, I need to lose weight.
Right.
But I'm talking about going through surgery
Mm-hmm.
and going through everything else that goes with being transgender or gay
Mm-hmm.
or lesbian or, anything like that. It makes it hard for people who, this seems so normal to me to be straight, or that if you're not straight, I just don't understand that because just feels normal. Or how abnormal it must feel for a transgender person to feel that uncomfortable in their body
Mm-hmm.
and that foreign inside their own skin.
Yeah. And I can tell you, and of course, this is always a source of controversy because there are people out there who, for whatever reason, because they don't understand it, are against this.
Right.
And maybe view this as...
Well, I think... Well, go ahead.
I was going to say, and that maybe viewing, wanting to be who you feel you are as some kind of disease or problem.
Right. And we'll get into this next, that it's technically still considered a mental illness.
Is it?
It's changing. That designator is changing quickly.
And I think that's better for me. I mean, not for me, but I like that better. And here's why. Is because of the people that I know that are making this transition, which, by the way, is a big decision, that are making this transition, to see them and talk to them before and after, you're talking to someone who is proud of themselves after. Right. They're just fuller. They're full of life. They don't seem to be just hampered down.
They feel right.
Yeah. And when you have someone who you're truly friends with, who goes through this experience, and to suddenly see them feel right, if you had any doubt, for me, if you had any doubt beforehand that this was the right thing for them to do, it's eliminated.
Right. When
you see them after they are truly starting to feel right again.
And it's interesting because there's controversy about that we'll talk about later.
Okay.
And try and hopefully clarify some facts.
Gotcha.
But you're talking about how people are so strongly against this. And I think that goes back to not being able to empathize with someone.
Right.
Not even being able to empathize with somebody.
Mm-hmm.
Just because it doesn't feel natural to me doesn't mean that it can't feel natural to somebody else.
Right.
And I think that part of the problem is education. Part of the problem is that what I feel seems so natural, I'm not willing to just try and understand how something else could feel just as natural.
Absolutely.
So, as I said, this is still considered technically a mental illness, but for a specific reason. So, a condition is designated a mental illness when the very fact that you have it causes distress and dysfunction. Right? So, one of the, I'm not going to say side effects, but one of the realities of being a transgendered human, on average, 42% of people who are transgendered have attempted or consider suicide.
Oh.
As opposed to general population of 4.6%.
Mm-hmm.
57% of, so there was a study done in 2014 where they talked to 250 transgendered adults, and 57% of them said family chose not to speak with them or spend time with them after they came out as transgender.
Wow.
Over half. Discrimination, victimization, violence at school, at work, when accessing health care, 50 to 54%.
Wow.
I know people who are transgender, and they have a hard time finding a doctor that will treat them.
Wow.
Right.
Which is a little embarrassing to be in healthcare.
Right.
For that, because I always look at our profession as the one place you should be able to go to not be judged.
We should be neutral.
We should be taking care of you.
Yeah.
That's what we should be doing.
Experience discrimination or harassment at work, 50 to 59%.
Wow.
Doctor or healthcare refused to treat them. I'm sorry. The previous number I said was a mistake. Harassed or bullied at school at any level, 50 to 54%. Doctor or healthcare provider refused to treat them, 60%.
Wow. Almost 2/3.
Just when we felt bad enough about it, So suffered physical or sexual violence at work, 64 to 65%. At school, any level, 63 to 78%.
So it almost seems like this is qualifying as a mental illness, not necessarily because of the person, but because of society's response
Right.
to this.
And this is why it's changing from being a mental illness.
Yeah.
Is because before, the associated psychological disorders that came from being, losing your support system. We talked about it in our psychiatric
Absolutely.
episode where, a good support system around these people are going to make a world of difference in their treatment, long-term treatment.
Mm-hmm.
For transgendered people, having a good support system. And they show that when the people who are transgender are supported by their family and friends,
Mm-hmm.
all these numbers go down by over 20 to 25%.
And by then you're talking about general population levels.
Getting close.
Yeah.
Getting very, very close.
And so it is, I guess after you've read those statistics, it's no wonder that the transgender community has such a high incidence of suicide.
Mm-hmm.
And that is something that I'm going to say unfortunate. And the reason I say is unfortunate because this is oftentimes a hard thing to do. But that is something that I think if we have a motivated society that can turn into a supportive society,
Mm-hmm.
this is a problem where we can pull this away from that stigma of being a mental disorder.
Right. So,
unfortunately, society can be hard to change sometimes.
Right.
It's a challenge.
There are challenges. Again, it's trying to getting people to understand that just seems so natural to them is not natural to somebody else.
And that doesn't make it abnormal. It just makes it different.
Right.
And that's what's hard for people, I think.
Right. People, for some reason, and especially people who are in a portion of society that is generationally against these things. Or they feel that there's a divine word against these people.
Yeah.
So they're not even willing to try any sort of understanding. Then you run into things like in 2016, 23 deaths of transgender people in the United States due to fatal violence.
Wow.
And then that was most ever recorded. Right? So 2017, 28 transgender people shot or fatally killed by other violent means. So it's on the rise. For no other reason than trying to feel natural in their own body.
Yeah.
So then you wonder why these people feel they don't feel comfortable in normal society or in straight society.
Yeah.
But one of the things that this 2014 study came across was that, and this is why it's no longer going to be thought of as a mental illness, is that once you address the gender dysphoria through either hormonal replacement or sexual identity reassignment, that part of the problem went away. So the disease, the condition is not creating the mental illness side of it. Society is creating the mental illness side of it. And so that once you fix, the person's identity, or have the patient not fixed, but have reassigned the person's identity to what they feel like.
Yeah.
That everything associated with that gender dysphoria goes away.
Yeah.
But they still have the suicide rates, and they still have all these problems and all these associated illnesses because of what society is putting on them.
And you even got to think about it, even after someone has come out as being transgender, even if there is that support system, you have to think about how they were feeling before that for so long. All that time before coming out, everything that they think about that's going on, the fears that are very legitimate fears based on the statistics that you read leading up to that.
Right. And a lot of times, people think that, people's misconceptions of this is a choice. They're choosing to be this way. No, they're not choosing to be gay. They're not choosing to be lesbian. They're not choosing to be transgender. This is how they feel. This is, when you're transgender, it doesn't feel natural. But they've also documented down to the ages of 4 where children start identifying. Maybe they're not coming out and saying, I'm transgender, but through their actions and their statements, they're being identified as transgender because they have an intense dislike of their own body.
Wow.
And they can start expressing that as young as the age of 4. So this is how they've lived their whole life. And so, yes, that is going to create these other issues. And if you add on to the fact that they're transgender and they feel uncomfortable in their own body, not uncomfortable, it feels wrong, then you say that they're one of that 57% that their family stops interacting with them and their friends stop interacting with them. So now, not only do you feel wrong in your body, but you feel like you're wrong for feeling wrong.
And you're alone.
And you're isolated.
Yeah.
And you're being harassed at work. You're being harassed out in public. You can't go to the bathroom without having to worry if you're going to be attacked.
And so for those that still strongly believe that this is a choice, the only thing I would ask you to consider is that with these numbers and these facts, if this was a choice, why would you make it?
Right. Well, and the counterpoint I have is, well, did you choose to be heterosexual, Chris?
No. I just felt I was.
Right.
Yeah.
And that's how these people feel.
Absolutely.
And then they're told by society that that's wrong.
Mm-hmm.
And hopefully they're in the 43% of people whose families support them and tell them that, no, you're not wrong. You may look at the world in a different way, but that doesn't make you wrong.
Yeah.
So there was a Williams Institute, if you want to see some very startling statistics, they did a very, if I remember correctly, 5,500 people study, talking to people about being transgender and all the things that they've gone through. And it's a very long paper, and I'll put a link on the show notes for it if you want to have some very, stark reality of numbers about this. So, gender dysphoria involves a conflict between a person's physical or assigned gender and the gender which he or she may identify. People with gender dysphoria may be very uncomfortable with the gender they are assigned, and sometimes described as being uncomfortable with their body, particularly developments during puberty, or being uncomfortable with their expected roles of their assigned gender. Okay? This does not mean that they're gay or lesbian.
Mm-hmm.
You can have a person who is straight, but they feel they're in the wrong body.
Yeah.
So if you have a female who feels that her assigned role at birth is wrong, she may be attracted to women, not because she's a lesbian, but because in her world, in her mind, and in her reality, she would be more comfortable as a man. So she's not attracted to men.
Yeah. And likewise, though, or I guess it would be the other side of this, it's also something that could happen to where she may be attracted to men,
right,
but may also identify as male.
Right.
In which case, that
right.
is where you could, and I think that's a hard concept because, again, a lot of people have a hard time separating sexual orientation from gender identity.
Right. Another thing people have a hard time separating is gender dysphoria with body dysmorphia.
Okay.
So, body dysmorphia is where you're unhappy and you obsess about how your body looks.
A famous actor who had substantial body dysmorphia was Carrie Fisher.
Oh, really?
Princess Leia, yeah, Princess Leia from the Star Wars series.
Mm-hmm.
Unfortunately, she's passed along.
Right.
But yeah, she had substantial body dysmorphia.
I read one person who has spent hundreds of thousands of dollars trying to look like Barbie.
Believe I've seen the same thing.
Yes. They obsess about how their body or parts of their body look to the point that it can interrupt their daily life and their ability to hold down jobs.
There's actually a trend among men to actually inject vegetable oil subcutaneously over their biceps or their pecs. Because what it will do is it will create a swollen appearance. And it basically makes them look buffer than they are.
For how long?
I can stay in there for some time. Unfortunately, what happens to it is it actually causes a substantial infection.
Right.
And so what they're actually getting is, and it will stick around, is they'll actually get a development of cyst and infected tissue that becomes hardened. But it is a trend that has unfortunately been catching some steam.
I don't understand that.
Right.
Again, I don't understand it. Now, this body dysmorphia is a mental illness.
Well, and exactly, and this is one of the reasons that it can be so detrimental is that you do have, for example, these are men who are unsatisfied with their appearances. They're often men that are actually fairly physically fit.
Right.
But no matter what they try, they're not satisfied when they look in the mirror.
Right.
And so they turn to unhealthy alternatives because anything
Right.
anything to get the body that
it's
I
not
want.
that they're in great shape, but they have to get rid of that last line of fat along the bottom of their abdomen, or their chest isn't cut enough.
Absolutely.
Or their arms aren't cut enough, you know.
But now gender dysphoria.
Right. What about it? Oh, I thought you were going somewhere with that.
No.
No, gender dysphoria is...
to get back on track.
Yeah, no, gender dysphoria versus that is the fact that you just feel... It's not that you are obsessing about how your body looks. You feel you're the wrong gender. You're not in the correct body.
Yeah. And there are aspects of that may have something to do with the aesthetics of your body. But...
Right. You know. And then also, neither of these need to be conformed with gender nonconformity, which is... behaving and appearing in ways that are considered atypical for one's gender. The one that popped to my mind, and people may disagree with me, was a tomboy.
Okay.
You know, a female who generally doesn't wear dresses and doesn't do her makeup and everything like that. I'm not saying if you don't wear dresses and do your makeup that you're not feminine, but, you know, you would rather go out and play baseball or fishing and hunting and...
Stereotypical guy stuff.
But, you know, and these people, I think, are...
But in that case, they still identify as female.
They still identify as female, and there's no real connection between homosexuality and people like this.
Okay.
So, or if you have a guy who doesn't play baseball and football. So your DSM-5 diagnosis for an adult male. Then they have slightly different choices for... children and adults. So you have to have at least, I believe, 2 of these for at least 6 months. A marked incongruence between one's expressed or experienced or expressed gender and primary and or secondary sex characteristics. A strong desire to be rid of one's primary and or secondary sex characteristics. A strong desire for the primary and or secondary sex characteristics of the other gender. A strong desire to be of the other gender, a strong desire to be treated as the other gender, and a strong conviction that one has the typical feelings and reactions of the other gender.
And this is 2 or more?
Yes.
What are the primary and secondary sex characteristics?
I believe primary is going to be genitalia.
Okay.
And secondary, I looked this up and I forgot to write it down. Let's see here. While humans are born with obvious primary sex characteristics or body structures directly concerned with reproduction, that allows us to tell males from females, such as a penis in women, vagina, penis in men, vagina in women. Secondary sex characteristics, on the other hand, are features which appear at puberty. Okay, so breasts.
Okay.
Facial hair, genitalia hair, I'm assuming. Along those lines. Those would be your secondary sex characteristics. Pubic hair, breast development in females, beards in males, more pronounced body hair, angular features, getting that square jaw, narrow hips, muscular pectorals, something you and I have never had an issue with, less fat tissue overall, something
So
I've
we
never...
have massive pectorals, is that what you're saying? Or just we've never had pectorals?
No, we've never had pectorals, either one of us. Deeper voice? Yeah. You know,
you didn't actually need to make your voice deeper, Mark.
I know I want to, though.
Yeah.
So, a lot of these for children are fairly similar. A strong desire to be of the other gender, or an insistence that one is of the other gender. A strong preference for wearing clothes typical of the opposite gender. A strong preference for cross-gender roles in make-believe play. A strong preference for the toys, games, and or activities stereotypically used or engaged in by the other gender. So this is where you get the kind of crossover with gender nonconformity.
Okay.
You know, a strong preference for playmates of the other gender, a strong rejection of toys, a strong dislike for one's sexual anatomy, and a strong desire for the physical sexual characteristics that matches one's experienced gender. And like I said, they've shown that children down to the age of 4 can be showing these characteristics, that they don't want the genitalia they have.
Mm-hmm.
You know. And I don't think we can express enough that what these people need is support and not judgment. Now, there are different levels of this. There are people who are perfectly happy with hormone replacement. I met one person who wanted to transgender to be a male, but once they got on the hormones, they couldn't stand how it made them feel.
Okay. And
so they could. And one of the reasons was the market increase in sex drive. They said that, it just the constant focusing on sex drive was very distracting to them. And there were other problems with taking testosterone, and how it made them, how their body reacted to it and stuff like that. And so at that point, that person decided to transition back to being female.
Okay.
Right. Now, that doesn't mean that they aren't still transgender. It wasn't a choice that they made. Basically, the choice they made was how they decided to live the rest of their life because of how the transitioning made them feel. And they are now married. And this person I was talking to said that, they don't want to necessarily stay home and take care of the children, the traditional female role in a relationship. Luckily, they're married to somebody who she's married to a guy, and he does want to stay home and take care of the children.
That works out.
But so even though the best option for this person was to transition back into a primary female representation of themselves in society, they still do have that transgender urge, but the reality of that, of changing over, just wasn't acceptable to them. Okay. So, a lot of times your treatments are going to be psychological. As again, therapy is going to go a long way because of all the things that go along with it. The feelings of guilt, the feelings of shame, the feelings of depression.
I also want to say it's important to note, excuse me, that when we talk about treatment, we're not talking about curing somebody and making them feel like the gender they were born into.
That doesn't work. Study after study has shown that trying to make somebody feel like they are the correct gender or that they are heterosexual when they're not, just doesn't work.
And so these treatments focus more on helping people
be psychologically healthy and happy.
Sorry for my pause there. Yeah. But helping people be happy, and in some cases, helping them to make the transition into the gender they feel they are. And so these treatments include, for the gender dysphoria, do include counseling. As Mark already talked about, hormone replacement therapy, puberty suppression, and then gender reassignment surgeries as well. Gender reassignment surgery being, a huge decision.
Right. That is a huge decision. And
I think they're all actually huge decisions.
They are, because when, again, you touched on it earlier a little bit, why would you choose to put yourself in a situation where you are always in a position to be shunned, attacked, assaulted verbally and both physically and sexually, based upon the fact that you didn't feel comfortable in your own body.
Absolutely. And so the only reasonable way somebody would go through hormone replacement therapy or gender reassignment therapy, or surgery rather, is if just look at that risk versus benefit analysis. These are people who, unfortunately, have to go through life knowing that the risk of doing so, the risk of violence and being mocked and ridiculed is so high, but that the benefit that is inside is worth it.
Right.
And when you think about that, and what must be, how must they feel to take on the risk of violence and, being shunned,
right,
just to be able to feel right again,
just to feel normal. Well, not even necessarily. I don't want to say normal, because it's not that they're abnormal to begin with.
Yeah, but
it's just to feel right in your own body, to feel natural.
Yeah. So if you're in a spot where maybe this is difficult for you to understand, just try and think, what in your life would be worth losing your family support over?
Mm-hmm.
And if you can try and think of whatever that is, that's the same passion that transgender people experience on a day-to-day basis,
right,
just to try and be the gender that they know they are.
You're willing to make a change to your body that could block your ability to get health care, that could block your ability to get a job, that could block your ability to get housing. To, again, you lose the support. 57% of these people lose support of their family. So you're not going to have that support structure or that interaction that you want and that you need.
And I want to point out that as bad as things can be here in the U.S., it can be far worse in other countries, yet people are still trying to get...
Pakistan, I read today.
Yeah.
Pakistan has their first transgendered TV anchor.
Yeah. And so when you're looking at the consequences, as bad as they can be even here in the U.S., there are corners of the world where they can be far worse.
They can be just shot on sight.
Yeah. Yet, it's worth it for these people to still try and become who they know they are.
To be natural in their own body.
So that should tell you. So if you had doubt,
right,
I would hope that those thoughts would guide you a little bit more towards trying to understand.
Well, and a large part of the problem is the fact the way these things are reported. There was a 2003 study in Sweden where they did a 30-year retrospective study of people who had gone through gender reassignment. And the way the study was set up, they showed that these people still had a really high suicide rate, and that they still had a lot of these problems. So this got reported in a way of, well, then what's the use of doing this? Why do this if it's not going to make a difference? So the backlash came of, well, if this isn't going to make a difference, then we shouldn't acknowledge their gender identity crisis because it's just making things worse. It would be better at that point to not acknowledge this as an illness or something that's legitimate because it's not helping. What they didn't do in that study, or show in that study, was they compared the suicide rates post-operatively to the general population. They didn't go into suicide rates of preoperative versus postoperative patients. Which
to me is a huge red flag.
Right.
When it comes to studies.
Right. And again, and I don't think that they did it as a way to make a point. I think they just had a flawed system.
Yeah.
So this backlash, like I said, and this is what they're going to do. They'll quote the study. Well, also they didn't look at was the difference between people who had preoperative or were postoperative surgical patients before 1992.
Okay. And
people that were after 1992 to 2003, when we had improved techniques, we had improved, so the person was even closer to being the gender that they identify with. And they showed that even then your suicide rates, everything dropped even further post-operatively because they felt natural in their body. And any sort of suicide or depression or anything else didn't come from the fact that they felt out of place in their body. It came from external influences of society putting it on them that this was wrong.
Yeah. I do believe, however, I think part of the fact that we are talking about this right now, and part of the fact that talking about being transgender has been on the tip of everyone's tongue lately, I like to look at the bright side and that we're starting to see a positive trend. We're starting to become more aware. And I think I personally don't believe we're there yet for transgender acceptance. No. I think we're along...
We're not there yet for homosexuality.
No, we're not.
As a nation.
We're not. I think we're a long way away.
Right.
But that being said, I think we are starting to see more and more understanding
Right.
as we push on. Again, we have a very small slice of the pie that I would say is understanding of that, but then it needs to be a much bigger slice. But I think what we have to do is we have to keep that conversation going.
Absolutely.
What I think one of the worst things that could possibly happen is that a particular community, we live in the Portland area. Historically, more accepting area when I think you compare it to like the average of the country.
Right.
However, what I think can sometimes be a detriment is when we feel things have gotten good, we tend to stop talking.
Right.
We tend to stop talking about it. It's almost like stopping your antibiotics because you feel better.
Right.
That can just make things worse.
Well, it seems like it's less of an issue when it's not less of an issue.
Yeah.
Just because it's more accepted.
Absolutely. So I think it's one of the conversations that we need to keep having and have it again, so we can start driving down some of these numbers.
If we're going to get into how society respects these people, I think that part of the conversation should be how they're interacted with on different levels.
I think particularly in the medical community as well.
Right.
And one of the statistics you'd mentioned earlier is that there are, unfortunately, medical professionals out there that are refusing to treat transgendered patients. One of the things that a transgender person and that society needs to be aware of is that, in general, it's not okay to, let's say you know someone who identifies as male, but you know them well enough to know that biologically they were born female. It's not okay to refer to them as a gender they don't identify as.
Right.
You need to refer to them as who they identify as because that is their gender.
Pronouns are very important.
Yeah.
Using the correct pronouns and the correct gender identification is very important when speaking to, about, or with these people.
Yeah, because that's a huge part of it, is being accepted by society for who you are, not who you biologically happen to turn out. Go ahead.
I was going to say, along those lines, things like, if you identify as female and you are biologically a male, but you are representing yourself to society as a female, there have to be laws in place for you to use the female restroom.
Right.
Now, the big blowback on that is, well, I don't want some guy in there with my daughter. Well, you're right.
Yeah.
You don't want a perverted male in the bathroom with your child. The problem is, and the disconnect is that there is no greater incidence of pedophilia amongst transgendered people than there is in the general population. And there is, as far as I know, there has never been a conviction of a transgendered person sexually molesting somebody in a bathroom.
I think what that is that is a manifestation of someone who does not understand. And it is more of a manifestation of their own discomfort with something they don't get.
Well, they don't understand it. It's so outside their realm of understanding because this is how I feel. This is how a majority of society feels, being heterosexual.
Yeah.
That I'm just not able to or not willing to try and understand that is not how this person feels. And so they have a violent response.
Yeah. And so then there's also a little bit of controversy when it comes to the medical field. So one of the things that Mark and I just got done talking about here is that you need to respect someone's gender identity.
Right.
However, the question comes up, is it important in the medical field to know if someone is biologically male or female?
It can be.
Yeah. Particularly one example would be abdominal pain. I think that's probably a good example to start with. The main reason being is because biologically, females and males have different parts.
Really?
And these different, well, I've been told. And so, I don't believe it, but, and these different parts can cause different symptoms. I mean, for example, you may have a male who is biologically female and has experienced abdominal pain and cramping because they're having their menstrual cycle. That is a consideration during a medical exam.
Or, again, with abdominal pain,
Mm-hmm.
the patient presents themselves to society as male, but they still are biologically female.
Right.
And they have an ectopic pregnancy.
Yeah, because as we mentioned earlier, sexual orientation and gender identity are not necessarily linked.
Right.
So it's very possible that this person could be pregnant. Also in the cases of rape.
Absolutely.
Because we've already talked about violence against the transgender community.
Mm-hmm.
So these are situations where that may be important. However, what the care provider needs to keep in mind, that's the only time that that's really appropriate.
Right.
Is diagnosing these.
And even then, you need to be respectful.
Absolutely. And I think it's one of those things where communication is key. You have to explain, you really have to explain, it's like, hey, I know you're a man. However, if you are biologically female, I just have some questions pertaining to your symptoms that I need to know.
Right.
Have you had gender reassignment surgery? Is there a chance you could be pregnant?
Right.
Are you on any sort of, are you still having menstrual cycles? Because sometimes hormone replacement therapies can suppress normal menstrual cycles or change them.
Right.
And those are medically relevant questions.
Well, no, and I know I've spoken to a number of people I've known that are transgendered, transgendering from female to male. Mm-hmm. And they generally don't have the sexual reassignment surgery on the genitalia. They will get rid of the breasts. Mm-hmm. And I asked them, hey, I'm curious. I'm curious.
Yeah.
So, just out of curiosity, why not? And really the response I've gotten back is that the technology of the surgery to reassign you to a male leaves a lot to be desired.
Okay.
Going from male to female, they've actually been able to work out through over the years, a good facsimile of what would be a natural vagina.
From what I've been reading, very few men would be able to tell the difference.
Right. And so, but when you go the other direction, when you're going female to male, the ability to reconstruct or to construct a penis out of the biology that's there leaves a lot to be desired at that point.
Oh, gotcha.
And so they're like,
okay.
A, it doesn't look good.
Yeah.
B, it's not very functional. Mm-hmm. So I'm actually happier living my life as a man, but still being female biologically.
Gotcha.
Sexual organ-wise.
Gotcha.
So
that makes sense.
Yeah.
Well, I think this is maybe a little bit shorter episode than usual.
Right, but what I found was that we could either spend 4 hours doing this or cut it short. There's not a real happy medium, but I think we've covered our basics. It's maybe a topic we come back to in the future if there's a reason. Mm-hmm. But anything else you have to add? Yeah,
I think that the main takeaway here that I would hope our listeners would get from it is that a lot of the mental illness side of transgenderism is by and large caused by society's perception of transgender people.
And trying to force society's perception on them.
Yeah. What I would say to those transgender folks out there who are going through that transition, who have come out and taken that risk, thank you. I think you guys are the modern day heroes that my kids get to look up to. What you've done is you've taken something that's so important to you. You've taken a great risk in coming out with all the statistics out there, and you've done it.
It's paradigm shifting.
Absolutely. And it's one of those things that if everyone could be that passionate about being who they are, I think we'd have a better society. So I look up to you. I am a supporter.
And to all the people who are truly unable or willing to try and understand this from another person's perspective, I would give you the quote of Michael Stipe when he was questioned about his sexuality. And he said, the only time you need to worry about what I'm doing with my penis is if you're sitting in my lap.
Very true.
So, if nothing else, it has nothing to do with you.
Yeah.
So, I think this is a good place. So, my name's Mark.
I'm Chris.
That is Chris over there. Please follow us on Facebook at Medical Stuff. We are on Twitter at Medical Stuff or at Medside Stuff,
We have the
MEDSIDESTUFF. And if you would like to email us, please email us at Chris.
Medsidestuff@yahoo.com.
There you go. Anyway, y'all have a wonderful evening. And
don't
wait.
forget to check us out on iTunes and Google Play, and check us out on YouTube. If you subscribe on YouTube, every time we put up a new video, you'll get an immediate alert, and you can watch it right then and there when it's up.
Basically, you can find us through most of your... The only major app we're not on right now is Spotify.
Try and fix that.
Yes, Spotify, please pick us up. So, anyway, have a good evening, and...
Toast.